Not checking. Can I see what you see?
A very warm welcome to you all, and thank you for registering in such great numbers from across the globe for the first in a series of 8 NTD webinars. Now, it's a welcome opportunity in these unprecedented times to spend time together, highlighting the key themes of the new NTD roadmap 2021 to 2030, and that's in preparation for the launch scheduled for later this year. Now, we'll get to situate NTDs in light of the current pandemic, assess the impact on programs, especially on those that are close to validation, and also gain insights to chart the way forward. I'm Patricia Amira, and I'll be your moderator throughout these sessions. And the main aim is to keep them as dynamic and informative as possible. I encourage you all to take this conversation even wider by social media, tagging at WHO, and by using the hashtags NTD Roadmap 2030, COVID-19, Beat NTDs, and of course NTDs. All housekeeping reminders are presented on the slide that will be on screen at various times during the session, so kindly take note so that the sessions can run as seamlessly as possible in this new virtual normality. Now, on the first session today, we're going to focus on the essential shifts needed for post-COVID recovery and 2030 success. And we'll be hearing from a number of speakers today sharing their expertise and leadership from World Health Organization, our hosts who are steering the new roadmap. We also have ministerial representatives to get crucial in-country perspectives, as well as active players from philanthropic organizations. And I'll be introducing them as we move along the program. Shortly after this welcome address from World Health Organization Assistant Director General, Dr. Ren Mingui.
Thank you, Monitor. I'm so pleased to welcome everyone from all over the world to this webinar on neglect tropical disease and the COVID-19 pandemic. I would like to thank everyone for your interest and enthusiasms to support WHO work in tackling this disease of poverty. I also would like to welcome to our panelists, particularly the Minister of Health, Rwanda, Honorable Daniel Majani, Regional Director of WHO, African region, Dr. Soiti Moiti, our Dr. Moiti Masalada, Director of the NTD programs in WHO headquarters, Dr. Maha Hamani, Senior Director, Princess Court Abu Dhabi, United Arab Emirates, Miss Tusi Masiyima, the co-chair of Higher Life Foundation. We will also be hearing from Dr. Poonan Singh, who's a regional director of WHO Southeast Asia region, through the video message. So thank you to all who, despite the challenge of COVID-19 pandemic, are ready to spend some time with us today for this very important item and discussion. Today's discussion comes at a time when WHO is working with countries to finalize its new NTD roadmap for 2021 to 2030. This also comes at a time when COVID-19 posed a major threat to the continuity of essential health services, including those for the preventing and managing the full range of neglect tropical disease. The theme of this webinar puts in perspective the importance of the new NTD roadmap that will guide our work in the coming months and for the next almost 10 years. COVID-19 is absolutely set a global change to the public health landscape for a long time. Its economic and social impact will last for the years to come, disrupting health and well-being for millions. So the new NTD roadmap will be discussed and endorsed by the Member State Assembly. But this important and visionary documents propose a new model of operation, setting out a bright future. Its importance is even more relevant as we deal with the pandemic. The roadmap seeks to promote resilience, health system strengthening, equity, countries' ownership, and expansion of strong partnership and global solidarity. I will now go into the detail of these documents, and I will leave it up to this wonderful panels of speakers to look at the importance, particularly when the world in the grips of COVID-19's pandemic. I look forward to the outcome of this conversation and discussion, and they will certainly contribute to the implementation of the roadmap in our journey towards 2030. So thank you very much, moderators, and look forward to this very important, fruitful, and dynamic discussion. Thank you, moderator.
Thank you so much, Dr. Mingui, for your thoughts and, of course, the importance of the roadmap and the outcomes of this series of webinars. But before we proceed, here's a visual snapshot of where we are on NTDs. Yes, unprecedented progress made so far, and the journey towards the new roadmap targets continues, and this is why we're here. Now, this first panel will look at what are the essential shifts for post-COVID-19 recovery towards 2030 success. Now, if I could ask all speakers to be as concise with their responses so that we can utilize the time we have together efficiently. It is to our advantage as the NTD community, just as it is our motivation to keep our commitments front and center as we navigate current circumstances. And so what can we expect as the NTD community? What type of approach is necessary to bring about sustainable impact? Now, these are some of the questions that we'll touch on today. And to provide us with the all-important overview of the new roadmap, allow me to welcome Dr. Mwelechela Malechela, Director of the NTD Department at WHO. Dr. Mwele, you're leading work in finalizing the new roadmap. What are the main shifts you and your team are proposing, and how will these accelerate the demise of NTDs?
Thank you very much, Patricia. I'm thrilled to be able to talk about the NTD roadmap, but before I talk about the shifts, I would like to talk a little bit about the consultative nature in which this roadmap was created. It was coordinated by WHO, but co-created by our partners and countries, and by the whole NTD community. So we listened to regions and countries, we listened to partners, experts, and colleagues, and we had extensive public reviews. It focuses on putting people, countries, and communities at the center, and is based on the key principles of partnership, health system strengthening, and countries leading the way. It is embedded in the social sustainable development goals and focuses on universal health coverage with a focus on leaving no one behind. In order to reach the 2030 targets set by the roadmap of elimination, eradication, and control of these debilitating diseases, we envisage three main shifts. First of all, from process to impact. What gets measured gets done. This is a saying that's said so many times: what gets measured gets done. And so a whole focus on measuring impact and monitoring progress is part of this shift. The second shift is from vertical program to holistic cross-cutting approaches. And this focuses on embedding these programs within the health system, but also a focus on multi-sectoral approaches, particularly with water and sanitation, WASH, with One Health, with vector control, and also a focus linking these diseases to other diseases other diseases and conditions where there are linkages, such as mental health, disability, malaria, etc. So it's a moving from a vertical siloed approach to a holistic cross-cutting approach. The final shift is on partner support, moving from partner support and funding to country ownership and domestic financing. And here's where we hope that countries will prioritize NTDs. And when they prioritize NTDs, we'll be able to invest and fund in NTDs. These shifts have become more evident and more relevant during this time of COVID, when we realize that COVID has amplified inequity in almost every country. The NTDs are diseases of poverty and also perpetuate inequity. So the roadmap, with its clear shifts towards promoting resilience, integration, multisectoral action, and equity, serves as our path to recovery. We have a chance as a community to build back better and leave no one behind. There is a Swahili saying that says unity is strength, umoja ni nguvu. So let us join together to push forward these themes of the roadmap, and together we can. Thank you, Patricia.
That was fantastic there. Yes, umoja ni nguvu. Strength in numbers. You said it was a collaborative endeavor. That's the only way to go. Put people at the center. Of course, the SDGs and the UHC in there. And the three main shifts. Thank you, Dr. Mwela. As you've just heard, integrating and mainstreaming approaches at country level is critical to achieving success for the new roadmap. And getting to the communities, as you said, that are in need is at the crux of it all, doing things differently, I think, in regard to coordination. Country level ownership, again, very important. So I think it's a good time to hear how some, in-country work has been happening, how they've been coping with the delivery on their NTD commitments during this pandemic. We have with us Dr. Nsanzimana Sabin, who is the Director General of Rwanda Biomedical Center. Dr. Sabin, Rwanda's NTD program and COVID as well falls under your remit. There has been some very steady progress on NTDs, even as there are new COVID cases being registered. I think the last figures received stood at an increase of about 500 cases with 2 deaths. So Dr. Sabin, how are you ensuring that essential services are accessible to people who require continued treatment and care for some NTDs? Do we have Dr. Sabin with us? Okay, perhaps I'll get back to Dr. Sabin at some point, but I think with the African continent, which has the largest number of NTD prevalence, I want to say thank you for being with us, Dr. Matshidiso Moeti. You've heard some of the challenges, obviously you know of some of the challenges being faced at country level. And drawing from what Dr. Mwele mentioned earlier about the 3 main shifts that are envisaged in the new roadmap, Dr. Matshidiso Moeti, Regional Director of WHO, how do you think these will strengthen impact at community level? Can you hear me there? This is the world of technical differences. Ah, brilliant. Dr. Nsanzimana Sabin, you're back with us. Thank you. Thank you very much. I'll just do that quick introduction to you again. Dr. Nsanzimana Sabin, who's the Director General of Rwanda Biomedical Center. I don't know whether you got to hear a little bit of what Dr. Mwele Chela said earlier. But in regard to the Rwanda Biomedical Center, which the NTD programs and COVID falls under your remit, there has been some very steady progress on NTDs in your country, even as there are new COVID cases being registered. How are you ensuring that essential services are accessible to people who require continued treatment and care for some NTDs? Dr. Sabin. If you could just turn your mic on so we could hear you. Unmute. Right down on the left-hand corner. There's the mute and unmute button. If the main moderator could unmute Dr. Sabin, that would be great. Thank you. If the main moderator can unmute Dr. Sabin. I understand the microphone perhaps isn't working. We'll come back to you, Mr. Sabin. Is Dr. Mweti online? How are we doing now? Is Dr. Mweti online? And of course, this is the new normal, so we're going to have to get used to these technical glitches that will obviously happen now and again. Okay, whilst we wait for everything to come back online, it's a good thing I'm still here. Remember that we will be having a Q&A session later on at the end of this session. And of course, when we do that, we'd like you to direct your questions on Slido, using Slido. And also, seeing that we've got so many numbers online right now, which is wonderful, please make sure that the conversation transfers also to social media. Remember to tag at WHO. The hashtags for it are NTD Roadmap 2030, COVID-19, Beat NTDs, and NTDs. Thank you very much for putting up the Slido address, slido.com, hashtag NTD Roadmap, and of course tag WHO in your tweets. Let's take this conversation as far and as wide as possible. We understand the importance of the work that is being done here. And as I mentioned, in these unprecedented times, it is important that the work continues in earnest with the urgency that it deserves, and especially for all the good work that you all put in. How are we doing for connection now? As we wait for...
Hello.
Oh, good. Somebody's joined me. Hello.
Oh, yeah. This is Dr. Saban from Rwanda.
Pleasure. Glad we got you back on.
Thank you so much for having us. It's a pleasure to be here on behalf of the Honorable Minister of Health, Dr. Daniel Ngamije, was not able to attend. But again, as an institution in charge of all health implementation programs, so we are very happy to be part of this conversation. So you've asked a question. I could hear your voice very clearly, but I think there was microphone connection issues. But I've really understood, and it was an interesting start of this meeting on Umoja ni Nguvu from colleagues who just presented. So we in Rwanda, like many other countries in the world, we are fighting one enemy, which is COVID-19. But other health essential programs may be also important to watch and follow, so that we don't have double damage in this context. So when we talk about ensuring that essential services continue, we're talking about people continue to access the life-saving treatment. On neglected tropical disease, it's even important because some of the diseases are not very well known, and some health facilities have been struggling to ensure that the new programs and the new treatments are accessible to people. So in Rwanda, the evolving situation of COVID-19 has been always managed in a context that we adapt what we see, and we make sure that those who are most vulnerable or most at risk are protected and served with what we have being a protective or treatment services. So we've started with within our national NTD strategic plan, with integration of services, and worked on the awareness on the services and activities. So within our communities, we had to adapt because usually I had to rely on mass gatherings to provide such informations and awareness, and sometimes services were provided when you gather people in the same places. With COVID, that is the other way around. You don't want people to be gathering in the same places. How do you keep these messages and services maintained when you don't want people to be together with the context of this infectious disease? So the adaptation that was implemented had to go up to door-to-door distribution. As an example, for example, for nets, malaria, to protect, because one of the diseases that probably be surprising us in the context of sub-Saharan Africa is malaria as a good example. Within 3 days, you could lose lives. So distribution of services, of treatments, of nets from one to door has been one of our quick adaptation. In other programs like HIV, like neglected tropical diseases, instead of giving a monthly or weekly supplies, you had to give longer supplies so that you don't return or people move to look for services. So that also changed in how often do you supply with this longer period treatment was one of the things to consider. So there are so many things I would really mention, but I probably pause here for our follow-up questions. But maintaining uninterrupted services was very critical in this context.
So obviously, we're all going to have to change the way we've been implementing NTD programs.
Absolutely.
So as a medical doctor, you were until recently involved in NTD. Sorry, excuse that. But what changes are you preparing to implement during a transition to normalcy, which we'd all like to see, in some degree? So normalcy in a post-COVID-19 world, how are you going about this?
COVID-19 will change a lot of things we've been doing and how we do it moving forward. So I see a lot of things will be turning around, how we strengthen our health systems to deal with different threats that are probably not seen and we continue to be seen post-COVID.
Yes.
So there's expectation that we're probably going to work double or work harder than before to prevent the consequences of infectious and these neglected tropical diseases forward. An example is in the education sector. We've been working very closely with between health and education sector, using schools as a platform to pass messages and also some other services. So now that in Rwanda, for example, the schools are closed until September. COVID, no one knows exactly when COVID will end. But at least today, we know that we continue to maintain education, our education sector. And as schools, we probably turn into online platforms more and more. So how do we use this platform to maintain schooling and also maintain these health services in the context of current COVID, COVID changed, or even future frameworks?
Yes.
So I see a lot of transformations and we're adapting our systems. But the key around this is having a decentralized health system, which is resilient and capable to respond and to adapt to these changes with COVID or without COVID, because we don't know what is going to be the next pandemic.
That's right. I like that. Resilient, decentralized health systems. But I'm always keen to see news of some of the other novel healthcare approaches taking place in your country. I recently saw a video of robots at the front line of COVID centers. But thank you very much, Dr. Sabin. Now, what is coming through here is that closely coordinated partner support is essential in this journey. The possibilities, of course, are limitless, and when done right, can lead to great success. As we move forward, we're just waiting for Dr. Moeti to be able to join us. And I would like to ask that we have another video message from Dr. Poonam Khetrapal Singh, the WHO Regional Director, who's put together a special message for this session. Unfortunately, she wasn't able to join us. If we could have that video showing at this stage.
A very good morning. The emergence and spread of COVID-19 has caused the greatest health crisis of a generation. In addition to the impact of COVID-19 itself, the virus has impeded access to health services and exacerbated socioeconomic inequalities. Both are important factors in controlling and eliminating NTDs. I join you today to deliver a clear message. We cannot accept a new normal in which progress against NTDs is put on hold or reversed. Through the pandemic and beyond, the Southeast Asia region remains committed to leaving no one behind and to continuing our forward march against NTDs. For both endeavors, a WHO NTD roadmap is needed now more than ever. The Southeast Asia region has made remarkable progress against NTDs, which since 2014 has been one of 8 flagship priorities. In the past 5 years, we have eliminated 3 diseases from 5 countries. We continue to deliver the largest preventive chemotherapy program in the world. We have significantly reduced the incidence of visceral leishmaniasis and no longer have the world's highest numbers. We have adopted new NTD targets to sustain and accelerate our gains. I'm certain that with innovative thinking, we can navigate emerging challenges. Perhaps the greatest challenge in the way in which COVID-19 has changed the funding landscape. Member states may potentially divert funding to other areas. External donors may reassess priorities. But neither outcome is assured. The vigorous action of the NTD community can make a real difference. We must be active in delivering our message. At every opportunity, we must communicate why controlling and eliminating NTDs is so important in the context of the SDGs and WHO's triple billion targets. We must maintain and expand the donor pool. The Southeast Asia region and the wider NTD community has a rich history of innovation that it can draw on so that together we can achieve the targets and goals that we must. I wish you all the best for your discussions and look forward to being apprised of the outcomes. Thank you.
Wonderful. Now, as we've just heard, some game-shifting work going on in the Siro region, but going forward, more innovative thinking is necessary due to the impact of COVID on funding streams. So strong message there from Dr. Singh. And on that note, let's hear from some of our philanthropic partners who have been instrumental, absolutely instrumental. Sorry, we've got like big screens coming on in mobilizing funding streams. And it's great that we have 2 regional perspectives to speak to. Mrs. Tsitsi Masiwa, who's the co-chair of Higher Life Foundation, and Dr. Hamami, Senior Director at the Crown Prince Court, Abu Dhabi. Let's start with you, Mrs. Masiwa. The Higher Life Foundation has made significant contributions in the control of sleeping sickness. And as you've heard, the complexity that COVID-19 presents to eliminating NTDs, you know, there's political instability, the consequences of climate change, all these challenges that are faced that require resources to try and mitigate them. So, Mrs. Masiwa, what do you think would be the best way to mobilize political and financial support from leadership and the private sector on the African continent?
First of all, I just want to say thank you very much for the opportunity to be one of the panelists today. I think the work that the World Health Organization has done in the area of NTDs is incredibly powerful and very effective. So my comments are to build on a foundation that has been very compelling and one worth taking note of. There are 4 elements I would like to bring your attention to today. I think COVID presents us with a real challenge, and it has really disrupted the business as usual approach to our work. So the opportunity we have is, I think, in co-creation and design and implementation of NTD programs. Every hand has been on deck during this pandemic, from the public sector to the private sector to communities, politicians, all hands. And I think if we can carry that kind of approach where we have co-created solutions and implementation, we have a real opportunity to eliminate these NTDs. Secondly, I think another area is education. Education in terms of ensuring that we create platforms for intensive local conversations on the solutions that we are focusing on. I think in the past, you normally get your donor community talking to the ministries of health. And I think, again, we have an opportunity to ensure that the conversations are broader and deeper. The disconnect that I think exists between the private sector and populations that are affected with NTDs. And on the African continent, it's 500 million people who are at risk and need treatment for NTDs, can quickly be bridged, and I think can be tackled very effectively. Ownership of the problem at the local level and also globally is absolutely important, and the roadmap couldn't have come at a more opportune time than this. We need the politicians to identify politicians who are genuine champions of the problem. I want to give an example of what I have seen in Zimbabwe, my home country, where working with the N Fund, where the leadership of the N Fund has gone to identify first ladies on the African continent to be important voices to talk about the problem and bring it to the forefront when other diseases are discussed. And then the 4th issue is on just leveraging on the existing COVID community. There's so many, the kind of community outreaches that have been done have brought in voices that have been completely silent when it comes to focusing on pandemics. And I think if we just build on that momentum, take lessons learned, we have a real opportune time, like I said earlier, to be able to have a community ownership and a multi-sectorial engagement to solving the problem and eliminating the NTDs. I think I will stop there.
I know, I could see you could continue, but I was going to add, I really like what you're saying about this intense local conversation and including the youth, the young generation, because the African continent we have that in abundance.
Absolutely. Absolutely.
Yeah. So we gather that your foundation was able to collaborate with the Ministry of Health in Zimbabwe to conduct mass drug administration. Can you tell us a little bit more about how you did this during these difficult times?
The first thing was, I think, common vision and purpose. The Ministry of Health led in the charge, the communities from the at village chiefs and at various levels were very engaged in the process. And also our own staff members got into the community. It was just incredible to see the willingness for people to take a risk in a period of time when we are faced with COVID. So common vision of common mission and purpose was very important. Then secondly, we shared resources. We provided, in the past, we've only been funders. Our foundation has focused on funding. in partnership with the End Fund that has mobilized the greater part of the resources. But in this fight, in this year and going forward in the process of elimination up to 2030, we have become funders and implementers. Yeah. So we got, we dug in with our resources, vehicles, cell phones, iPads, to make sure that we had training that was effective for all the communities that were going to go door to door to do the MDA. And then there was a lot of flexibility. We didn't, there's always a system in place that one has to follow, but because the communities were facing, the MDA was necessitated because of the outbreak in bilharzia and in intestinal worms in children. And also we had cases of where adults had actually passed away because of some of these complications. It was, I think it was well worth our while at every level, from the government ministry level, Ministry of Health, to the community leaders, to us as a foundation and as philanthropists to get the job done. So we were able to do a coverage we surpassed our coverage target of 80%, and within a period of 2 weeks, which is really incredibly effective.
That's incredible. So the few of the things that you said there: common vision, shared resources, flexibility, political will, and of course, homegrown funding. You can't say no to that. I think an excellent example of how public-private partnerships can work at national level. Thank you so much, Mrs. Masiyiwa. Turning to you, Dr. Mona Hamami, Senior Director at the Crown Prince Court, Abu Dhabi. Like in other areas of public health, COVID is bound to significantly affect the NTD landscape. In that light, I wonder if you could answer this. Will this entail any change in your plans to support global work against NTDs? Dr. Hamami. If you could just unmute.
Yeah,
them.
Can you hear me?
I can hear you now. You need to unmute. There we are. We can hear you now. Perfect.
Okay, great. Sorry.
Did you hear the question? Should I repeat?
Yes, no, absolutely. I heard it. It just
Okay.
didn't tell me on to unmute. Thank you so much, Patricia, and thank you so much for the WHO for having this very timely meeting. So for us, COVID, just as any other pandemic, reinforces and perpetuates global inequalities. And our commitment to global health has always been in reducing those inequalities and looking at the poorest of the poor. So in that sense, it reinforces our commitment to global health and particularly to NTDs. I'll give you a simple example. With COVID-19, you're seeing now that kids are out of schools, that could potentially lead to huge inequalities in education that you see similarly in NTDs, with kids with schistosomiasis, for instance, not being able to go to schools. And so it has dramatic implications across the board, but also it reinforces the importance between global health and so many other areas like WASH, particularly the hygiene aspect of it right now, where preventative measures are extremely essential to tackle these issues. So for us, COVID reinforces the importance of commitments that we have made, but it also highlights the need for integrating NTDs into the bigger global health issues. So healthcare system strengthening that we talked about, integration into sort of universal healthcare systems, thinking about cross-cutting themes like access and logistics, diagnostics and labs, all are things that came through COVID, which we now as a donor start thinking even more so about it. How do we integrate those issues into our thinking, not just in terms of disease elimination, but in terms of strengthening those systems that we're looking at. So I think many donors now have shifted a lot of their commitments to COVID-19. We see our commitment to NTDs to continue and even stronger right now, but also there's room for integrating a lot of those responses to the current context. Yeah. I hope that gives you a bit of a glimpse, but for sure that's just a reiteration of the importance to keep focused on those issues. As you said, this affects so many other public health issues, whether it's malaria or others. So keeping the eye on the ball is extremely important, because that's just a reminder of how important those issues have been. And by neglecting them, we're just making vulnerable populations even more vulnerable.
And Dr. Hamami, how can the measures that are envisaged in the new roadmap help in this process?
It's exactly the stuff I talked about. The roadmap for once has broadened the discussions, right? It made the onus on local governments, so governments are responsible for this, but it also emphasizes those cross-cutting themes. Healthcare system strengthening is across the board, but topics like diagnostics we're not approaching things as just disease specific, but there's cross-cutting themes that are coming through. Importance of universal health coverage, all of which are topics that NTD has discussed in the past, but that reinforces it. But I also think that the roadmap, for the first time, shows the importance of talking to other sort of sectors. So the importance of WASH, for instance, becomes extremely significant. And so that reinforces the message. And I think COVID showed the importance of all those cross-cutting themes that we're talking about. I mean, health doesn't come in an absolute sort of vacuum. It's highly linked to so many other development issues, and NTDs is at the core of that. And I think Dr. Mweli had talked a bit about integration to WASH, to mental health, to disabilities, all of which we're now seeing the importance of.
Brilliant, thank you. Thank you so much for that. Dr. Moeti has joined us, and that's great. The African continent, as I had mentioned earlier, Dr. Moeti, has the largest number of NTD prevalence. And I want to thank you for being here with us. There's some great challenges that are being faced at country level. And Dr. Mwele, of course, earlier had mentioned the 3 main shifts envisaged in the new roadmap. Dr. Moeti, how do you think these will strengthen impact at community level?
Yes, thank you. Finally, I'm very happy to join this webinar and to join the NTD community this afternoon briefly. I think I'll start off by saying, actually, we're seeing that the NTD community is contributing to the COVID-19 pandemic response. So that's a great starting point already. This work has involved very much engaging communities, mobilizing them, working with them at their level. And we know one of the most difficult things about the COVID-19 response is the impact of all the measures on people, on communities. And it's already been said that some of the most vulnerable and marginalized people are severely affected by NTDs. So those methods of helping people to understand, to incorporate, to be empowered to take action have been very much part of the NTD community level interventions. And they're very much needed now so that people understand that I have to keep my distance. I have to wear my mask above my nose all the time and all of this. So just to acknowledge that contribution, because we've seen that many people working in the programs have been repurposed to support the pandemic. So we have lessons to learn then from the pandemic, which are very relevant and which are very much aligned to the pillars of this work that we are going to be doing going forward, of the roadmap. First of all, I just like to talk about integration, because I think that if we're looking at limited resources, limited programmatic resources in the countries, including human resources and others, we've recognized that we can't afford, and I think it's said in the documentation, we can't afford the usual siloed approaches. And here, I'm very glad that the NTD community has started with an integrated approach around the diseases. So I think we could do a lot of work to integrate both around people and around similar interventions with other diseases. For example, if we need to do vector control, which is important for some of the NTDs, we can do that together with the malaria program and put together our resources and our capacities. And it very often is the same people who are affected by both diseases. And let this be an integral way in which the health systems works to achieve these synergies. That is very important for our health systems to achieve. And then we can integrate around people. So if it's people, agricultural workers, people living in rural areas who have access challenges to health services, when we do have the opportunity for these people to interface with the health service, we need to design our work in such a way that these NTDs are part of the essential health package for each population subgroup, so that we can do this work together. We do a lot of mass drug administration campaigns, not only for NTDs, but for other diseases as well. So we could work around those synergies as well, so that when a district has to implement these programs, they are planned together. One of the big challenges we face in our health systems in Africa is very much around resources.
That's
so
right.
I believe, and if we can pull these resources together in a way that's scientifically based in terms of the type of intervention, in terms of who we are aiming to target and who we're aiming to provide the service with, I believe we can make the resources go a very long way. In WHO, we're working very much to pulling together our data platforms for NTDs and malaria, and to go beyond that to other data platforms so that we can have this information available to our users for a range of services, including those that tell us how resilient our health systems, how performant. If you're going to work in a district, you need to be able to know what's going on about health facilities, the human resources, the procurement system, as well as then the data in terms of disease profiles and impact. So I think we can do a lot around integration, and that's very central to our principles for health systems development and health systems strengthening, working towards universal health coverage. We will never do it with vertical programs. I think the NTD programs have made a very good start on pulling together. We can expand this pulling together forward beyond NTDs to deal with other diseases within the UHC platform.
And then of course, the post-COVID landscape as well. Some of these elements that you mentioned can be continued, of course, across the African continent, right?
Yes, absolutely. So the COVID finds us, in fact, on the pathway to this. You probably are aware of at the last UN General Assembly, heads of state committed to universal health coverage. WHO has been tasked with coordinating a global plan to put this in place. And some of these principles are very central to this work. I think we've recognized that after having seen some of the global health initiatives attempt to put in place a UHC component, we've understood that we need to turn this around and work very much on the basis of a health system that delivers for people, starting very much at the level of people, as I said, at the level of communities, then working out to what then needs to be added. We need infrastructure, we need human resources, we need the supplies, etc. We need data to tell us what's going on. If we work around those, the pillars of a health system, and then incorporate the needs of NTDs and other diseases, I think we can go a very long way on the twin path towards UHC and on implementing the roadmap towards achieving our objectives. If I can just finish around partnership and resource mobilization. We work a lot with ministries of health and advocate with ministers of finance. Please provide financing for malaria today, NTDs tomorrow, maternal health another day. I believe, again, if we can pull all our efforts together, and if we look at the burden of NTDs in African countries, and we look at the vulnerable groups and households, and we look at the benefits to African economies of succeeding on NTDs, this to me is a story that will resonate with the Minister of Finance who wants to invest smartly so that a healthy population is available to develop the economy of the country. So I think if we pull all of these together, because very often we're talking about women, these are the same mothers that we don't want to die in childbirth. These are the same young people that we want to have healthy. These are the same men that we want not to be dying of HIV or of chronic diseases. I believe we can pull all of this together. When we make our case, we can use NTDs as one of the most important priorities to illustrate how good it is to invest in the human capital through health. And I believe we can succeed in this way.
I'm sure we can. Thank you so much, Dr. Moeti. We've just got about 9 minutes left to the hour, so I really want to kind of jump in and get some questions in. Remember to turn to Slido to submit your questions. I have one here. How can we increase political will for all 20 of the NTDs, not only for a handful? Dr. Mwele, if I could direct that question to you.
Thank you very much. Thank you very much, Patricia. Initially, when the discussion was going on about talking about all the 20 diseases, there was a lot of angst about, can we really focus on 20 diseases? You have on one side diseases which were already having very strong programs, lymphatic filariasis, schistosomiasis, and you have on the other hand diseases which did not have good tools and interventions, for example, mycetoma. But the idea here, I think, is to put them all on the same platform, so that we can use the platforms that have been successful to try to push and move these other diseases forward. So in ways, for example, through the roadmap, we're talking about, let's improve diagnostic capacity, because we feel that diagnostics has been the biggest problem in a lot of these NTDs, which have not been given the same kind of, which don't have the same kind of status. So looking at those things, looking at what are the other therapeutics that we can find, what are the diagnostics, we can actually get these NTDs together, and then using these other platforms that have been successful to try and ensure that we can, and as Dr. Moeti said, one of the biggest things is trying to integrate and making sure that these diseases are taken up into the health system, or integrated with other programs that they can be integrated in.
Yes, yes. I've got another question here, which is extremely interesting. Are there any traditional ways, remedies confirmed by WHO, that help to fight or eliminate specific entities, especially on the African continent? I'd like Dr. Moeti to respond to that one, please. Dr. Moeti. Traditional ways and remedies confirmed by WHO. I think that's wonderful. Perhaps Dr. Moeti, you could also speak to this.
Yes, thank you very much. I think Wella might be better informed than I am. She's been at this game for long. I'm not aware, let me put it that way, but if any were being proposed, we would be very keen to work with whoever has found what might potentially be a remedy, to try it out, to carry out the kind of trials that show its efficacy, that show that it's safe to use, and then to go beyond that, to promote very much what's needed around the production, the promotion, and getting people to use that product. Because we've done a lot of work on traditional medicine with WHO in African countries for more than a decade, but we have not yet advanced to that level of production, making them available wherever you go, in pharmacies and markets. So we'd be very keen to help that, and maybe Merla will tell us about something that's possible here.
Yeah. Dr. Moeti.
No, like Sidi said, we don't have any remedies for now. I think but the most important thing is that, should they be available, I think it's really important for us to be able to test them and ensure that we have something that's safe and efficacious, that we can put out there. I think, like Dr. Moeti said, Afro has been working a lot with in the field of traditional medicine, but I think we need to move it forward and see what countries have. But for neglected tropical diseases, so far as I know, we don't have any known remedies or promoted remedies for some of these illnesses.
I'm waiting for the day. That would be absolutely wonderful. A question here for Dr. Mona and Mrs. Masiwa. Do donation programs create dependence? What are the exit strategies from donation-heavy programs to country-driven programs? Dr. Mona or Mrs. Masiwa could...
Okay, I can come in there. I think with everything, you have to be strategic in how you do your giving or your donation. So it's very important, and I've seen this applied in many different countries and by many different partners. Have an elimination pathway, which is what we are focusing on. So it's an elimination pathway where it's very clear what are the resources that are needed, and then also make sure the government is involved. They make a contribution from their budget. So it's not quite a donation, because people pay taxes and some of it is channeled towards MDAs. So part of that is the contribution to elimination process. So the key for me is, if you have a pathway to elimination, then there's no dependency. We are looking at a 2030 roadmap. And we want to be done to eliminate these NTDs by 2030. So, so that, for me, diversifies the risk of communities being dependent on donations.
Dr. Mona.
Yeah, hi Patricia. So I think from our perspective, and I did mention this before, once you approach this as we talked about, there is an elimination path for sure. But if you approach this as a donor about healthcare system strengthening, then you really are looking at this as when you actually are withdrawing your donations, you've also allowed for systems to become more self-sufficient. For instance, I'll give you an example. One of the things we look quite a lot at is community health workers and the importance of those, but also nurses and doctors and what have you. At the end of the day is how do you build those capacities? So when you withdraw, there's a lot of impact that is not just disease specific, but it's a system sort of transformation. I definitely think it's a very valid questions, but also as donors, you have to think about the impact of your work after you leave. I mean, there's no sense of just dependency. It's you're supporting others to come in and you crowd in more money through local governments and other partners, but you also build systemic change, which is very important.
Thank you very much, Dr. Mona. I'm going to try and squeeze in one question before we wrap this session, unfortunately, for Dr. Sabin. In Rwanda, what are the key technical changes to NTD program implementation in a post-COVID-19 world? Dr. Sabin. I know you have
Great. Thank you. It's interesting to follow all these great panelists talking about the different experiences. So with NTDs in this context, there's been a lot of adaptation and changes, but in all the steps we went through, the most important one was to make differences on what should we do now, what can wait tomorrow, or what can we not do or do differently. So the challenges have been that in many places, in many contexts, you will see that most of these health interventions are priorities. And how do you make priorities among priorities is always a challenge as far as funding is concerned. You're trying to stop a virus that is spreading quickly. At the same time, we're trying to save lives from other diseases, and finding a balance in between is a strategic decision you have to make. Sometimes doesn't depend on individual programs, and you have to bring different programs together. So again, I come back to the element of integration and decentralization of services, and timing. Timing matters a lot, because 1 day or 2 days in the context of epidemic can mean a lot when you think of a period where you don't have a pandemic like COVID. So if you combine all this, you'll see that we've learned a lot in the past 6 months than actually we've learned in the past 10 years, because we had really to do things so differently, so fast, that you don't lose lives or you don't compromise any program.
Yeah. Nothing like being under pressure, eh? Okay, so you mentioned that integration, decentralization, and timing, Dr. Sabam. And on that note, I have to say thank you to all our great speakers for sharing their expertise and in helping to set the stage for the NTD webinar series. Thank you also to the members of the press who have been instrumental in highlighting our stories out across the globe, essential partners towards successful outcomes. And last and certainly not least, a huge thank you to all of you at home or back in the office, wherever you may be, sharing your invaluable knowledge as committed actors in this important journey towards 2030. And the journey continues after a short visual break of about 5 minutes, when we will then begin our second session, where we'll explore the key to 2030 success, partnerships, collaboration, and integration for impact. Please continue to stay on. We'll see you after about 5 minutes. Thanks so much. Thank you.
Thank you, Patricia.
At the beginning of 2020, fexinidazole, the first all-oral treatment for sleeping sickness, was rolled out in the Democratic Republic of Congo. We start in France, where the treatment was produced and released by Sanofi and shipped to Democratic Republic of Congo by Médecins Sans Frontières Logistique. The World Health Organization and NTD collected the shipment in Kinshasa. It was delivered by the National Sleeping Sickness Control Program to the most remote areas of DRC where people are at risk of sleeping sickness. The journey from the laboratory to the patient's hand was a long one and is testament to strong partnerships between Sanofi, NTD, the DRC Sleeping Sickness Control Program, and many other partners. It is also a testament to the power of innovation in fighting neglected tropical diseases.
The youth are not singled out as youth in the roadmap. It's a definite miss if we do not actually articulate. So we're talking, when we talk about youth, we've included them in the partnership, but it's not enough.
We also advocate as the youth that we should be listened to when we talk about neglected tropical diseases, when we want to be part of the policy making, when we want to be part of the implementation of these reforms.
Seeing the role of young people into this roadmap. And if we are to achieve this, we need to have a transition from having a curative to a preventive approach if we are to, combat NTDs in the next agenda by 2030.
Dr. Mwele, and interestingly enough, someone asked her the question about the roadmap. It is actually on the declaration.
So you give me a great challenge to ensure that we actually put in a statement on youth in the roadmap. And I'm very happy to leave here and go and do that.
So that is a commitment. Thank you very much, Dr. Mwele.
And welcome back. And just a brief mention from the previous session, we were to have as well Dr. Let me get his name here, the Honorable Dr. Daniel Ngamije, who is the Minister of Health in Rwanda, but unfortunately he couldn't, join us for this session because he was called away for an urgent meeting at the presidency. So I just want to say thank you again to all the participants of the first session. In this next session, we'll have a practical discussion to explore how we can align and coordinate work with countries and stakeholders. Sorry, just catching my breath there. To enhance multi-sectoral coordination to achieve the global targets and examine the role of health workers and volunteers across various interventions. Once again, I encourage you to get your questions in through Slido. Of course, there's a team on hand as well to get those through to me. With us to help unpack this particular focus, though, are stakeholders from multilateral organizations, in-country representatives, and pharmaceutical partners as well. A warm welcome to the panelists, Dr. Musab Siddiq El-Hag, who is the Director of Disease Control Directorate, Ministry of Health, Sudan. Dr. Charles Mwansambo, Director of Health Services, Ministry of Health in Malawi. Leda Hernandez, Division Chief, Infectious Diseases, Ministry of Health, Philippines. Luke Kuiken, Senior Vice President of Sanofi. Rachel Taylor, Director, Corporate Responsibility at Merck. Dr. Neeraj Dhingra, Director, Vector-Borne Disease Program, Ministry of Health in India, Dr. Wendy Harrison, the CEO of CSI Foundation, and Helen Hamilton, Senior Policy Analyst at WaterAid, and last but not least, Dr. Tajindra Yoga Aditama, who is the Senior Advisor of WHO Zero. So to start us off on this discussion and bringing it right into one of the pillars essential to achieving target, changing operating models and culture to facilitate country ownership. Dr. Musab Siddiq El-Hag, how has the current pandemic affected the implementation of programs for NTDs in Sudan?
Thank you, Patricia, and thank you for the WHO for giving me this opportunity to address the neglected tropical disease verdict.
Sorry to interrupt you. If you could just turn your volume up slightly so we could hear you much better. Thank you.
How is it now? Is it okay?
It's much better. Yes, thank you so much.
Yeah, I'm saying thank you, Patricia, and thank you for the WHO for giving me this opportunity to address the NTD world. Now I am seeing quite a lot of participants here with us. And I would like to take the privilege of speaking after Dr. Moele, Dr. Muiti, and Dr. Sapin, because they are already addressing many of the challenges we are facing now towards having a neglected tropical disease program running during the COVID-19 era. Most of our MDAs now stopped, especially by the closing of the schools and the prohibition of the market days, where we are mostly depending on the market days to distribute our drugs, especially in Darfur states, where we have like a huge gathering of the population, and we could deliver the drugs at these communities. And also, I think the drug transportation and even the delivery of the drugs inside the country has much affected by the curfew, by the shipments to the country. The airlines are not probably working in the most of the time like in the past. And now we also have like the perception of the communities itself. Now people are a little bit have a fear regarding the close contact with the drug distributors, close contact with much of the health care providers. So addressing these issues now, it's like a main challenges for us, giving the right messages for the people and changing also the messages from staying at home to stay at home carefully and visit the health facility when you are having symptoms. This is also has to be a new message to be addressed to the.
And yes, you're right. The task of addressing these diseases is very, it's monumental. Besides the support of WHO, how else is Sudan managing to tackle these diseases?
Yeah, besides the WHO, we have many other partners and stakeholders like the Carter Centers, SciSaver, Ascent now is on board with us, the TLMI, and a lot of other partners. But additionally, at the Federal Ministry of Health, we adopted the integration approach since 2014. And we integrated the neglected tropical disease program inside the disease control directorate. We much benefited from the facilities being provided by if I can say, the RICH program, the Global Fund, for example, program. We are using the facilities of this program to deliver the drugs, for example. In addition to that, we are using the NMSF, National Medical Supply Fund facilities to store our drugs, to distribute the drugs to the state out of cost. And now recently, we have the new partnership with the National Health Insurance Funds to include neglected tropical disease training and drug distribution through their health facilities. Unfortunately, the new government in Sudan, the transition government, had increased the domestic funding towards all the health sector. And I can say, fortunately, in the neglected tropical disease program, we received about $4 million support to the neglected tropical disease in 2020 budget for the Federal Ministry of Health.
Fantastic. Dr. Siddiq, is Sudan ready to achieve guinea worm-free status anytime soon?
Yeah, we plan to have like the certification in 2020. At the beginning of this year, we prepared the draft of the country profile and the country dossier was finalized, the draft one, and we sensitized the communities. We started the community-based surveillance and the active case surveillance. We integrated the active case search for all of our communities inside the mass drug administration campaign, and we had like a very good and wide distributed campaign for searching for the guinea worm cases and investigating the rumors, and also for searching the animals, guinea worms around the affected countries. Sudan is bordering by three affected countries, and we strengthened the surveillance in these areas. We were much ready to have the certification by 2020. Unfortunately, the last 6 months, we have been prohibited from doing the active interventions for the guinea worm certification activity.
Okay. Thank you, Dr. Elhad. Let's get another in-country perspective here. Dr. Charles Mwansambo, in your role as Director for Health Services in the Ministry of Health, Malawi, and for this first question, kindly just speak to bilharzia, which unfortunately is still a major concern in your country. Having listened to Dr. Elhad, what is being done to eliminate it? And then secondly, how is the pandemic affecting treatment in schools?
Thank you very much for giving me the floor. I should say that the Malawi government is working with a number of partners to make sure that we control and eliminate NTDs. But I know that you picked on bilharzia, which is still giving us a challenge at present. But we're working with Schistosomiosis Control Initiative and also another organization called World Vision International to do mass drug administration and also regular assessments of that. But obviously, COVID has not spared us because we are one of those countries that closed our schools before we had our first case of COVID. And indeed, now we are at about 564 cases. So that has affected some of our problems in that we've used the schools as one way of delivering this mass drug administration. I stop there for now.
Okay, now Malawi recently eliminated LF. Is recently eliminated, LF as a public health problem. What are the role of partnerships in this success? Because it is a success.
Yeah, of course, alone as government, we cannot manage this. We have to work with a number of partners. I should thank DFID, before, of course, it got merged with the Foreign Office yesterday. Yeah. Through the Center for Neglected Tropical Diseases, who've worked with government in a number of activities. We've done some mass drug administration together. We've done the mapping of LF cases together, even the hydrocele camps and even the home-based lymphoedema management, we're doing it together. So this is greatly appreciated indeed. And also to thank the Mektizan donation group, I mean, these various drug donation groups that with the technical assistance of the World Health Organization have helped us achieve what we've achieved. So that's much appreciated indeed.
Okay, thank you very much, Dr. Mwansambo. I think it's probably a good idea to talk more about partnerships at this point. Leda Hernandez, Division Chief Infectious Diseases in the Philippines. The new roadmap identifies monitoring and evaluation as one of the 4 key cross-cutting interventions across many diseases. How important is it to develop monitoring and reporting strategies into a country's health management information system? We do have Dr. Hernandez with us, Leda Hernandez with us.
Yeah, good evening. It's evening in the Philippines.
Good evening to you.
Yeah, first of all, thank you for inviting me as one of the panelists in this webinar on NTD. Yes, of course, monitoring and reporting strategies in the country's health management information system is very important. As we all know, monitoring and evaluation systems allow us to measure performance as well as results. And the information gathered from this information system should be systematically collected as well as organized. And in our Department of Health, we have the Health Management Information System, which captures data and information at all levels of the health system. And by doing so, this helps us to plan and act based on evidence. We can also use this for policy making and decision making during our planning, during the implementation and evaluation of the NTD programs. We also use this to manage our resources properly. The monitoring, evaluation, as well as reporting through the Health Information Management Information System leads us to better understanding and, of course, performance tracking of our NTD program implementation to assure us that we are getting there, that we are achieving our goals and targets. We also have included the NTDs in our own Philippine Action Plan. That's fortunate for us. And again, I do believe that this is very important, the monitoring and reporting in any country for tracking health programs.
I'd love to hear an example of this. Could you give us one, please? Could you share something where all or some of these elements actually took place with a specific disease?
Like, for example, for LF, in order for us to have funding from the local government or for the Department of Health, or in any level of the health sector, you have to show data, and this data should be evidence-based, and this is again collected through the information system existing in the department, and data is very powerful, and by doing so, this can be turned to policy. Like, for example, we push for the integration of activities, integration of NTDs in the implementation. So we have to show our policymakers that that integration of programs is feasible, manageable, and this can be done or collected through the health information system and through the monitoring. So in any occasion, like for example, in the Philippines, we do annual NTD stakeholders forum, wherein we showcase all our or the good practices in the implementation of NTDs. And this is participated by different stakeholders, experts, policymakers, implementers, researchers. So those showcase activities or data in that NTD stakeholders forum usually came from the health information system.
Okay, I really like this thing that you keep talking, the power of data to help strengthen capacity effectively. Thank you for that. Luke Koiken, Sanofi's support for some diseases, particularly sleeping sickness, has been absolutely exemplary. A decade ago, no one would have believed that we would be talking about eliminating sleeping sickness, even daring to interrupt transmission. It would be good to get some insight into how partnerships can work. How, or did WHO motivate Sanofi to support the fight against sleeping sickness at the time when it sounded like an impossible task to many?
Thank you, Patricia, for the question, and I'm happy to join this this webinar today to highlight the importance of the new roadmap, right, for NTDs in 2030. And before answering the questions, I want to recognize WHO for the efforts they made in being really inclusive in the development of this roadmap, which is really exemplary. But so one contributing factor for us to promote the integration of NTD activities at all levels of the healthcare system and working with WHO was really by pushing ongoing innovation, both in diagnostics, in drugs, and in services. So if we take the example of human African trypanosomiasis treatments, treatments were very complex, right? People needed to receive intravenous administration of drugs for 2 weeks, and you can easily understand how difficult that is to bring these treatments close to patients, close to communities, and it was fraught with many logistical challenges. So the work we did together with WHO, with DNDi, and with many other partners was the development of treatments that would be more appropriate to be implemented at the primary healthcare level. So we developed this 10-day oral treatment, vaccinidazole, which is now being rolled out. You saw the movie earlier in the break for the program and the rollout in DRC. But this level of simplification will allow us to bring treatment much closer to patients and healthcare providers in really rural areas of Africa, right, and improve access. And so some of these factors and the integration of case detection and treatment at the primary healthcare level is, for me, really the only way we will achieve the 2030 target of eliminating transmission of sleeping sickness, and ultimately a strong contributor to universal health coverage, without which I don't think we will ever reach the targets we have set.
Okay, you've been supporting other NTDs such as leishmaniasis, Chagas disease, Buruli ulcer, and yours. How are you planning to support integration as part of the new roadmap?
Yeah, I think one factor that we need to recognize, and I think it was Tumuele mentioned it before, was as we are moving more and more from vertical programs towards integration in primary healthcare, I think one area we need to really think of is the ongoing collaboration in education and training of healthcare workers at all levels, right? If we want to assure that NTDs are treated at the most appropriate level at primary healthcare, in primary healthcare centers, let's make sure that the healthcare workers receive the appropriate support and training to diagnose and treat and ultimately eliminate those diseases. So I think that's one of the areas where we can continue to contribute very strongly towards the roadmap 2030.
Thank you so much, Dr. Koikens. Closely coordinated multi-sectoral ecosystems. Now that access to medicines is a key cross-cutting element across many NTDs, Ms. Taylor, if I could turn to you at this point and just ask, as a long-standing partner and donor of ivermectin for river blindness and lymphatic filariasis, how do you see the shifts of the new roadmap on NTDs?
Hi, Patricia. Thanks so much. Thanks. Oh, hello. Hi. Thanks so much to you and the organizers for this opportunity to share some thoughts from MSD. I'd like to start off by acknowledging and really saying that we welcome the new roadmap and applaud WHO for undertaking such a highly consultative process to develop it, really giving ownership of this agenda to all of the NTD stakeholders, really focusing on the partnership principle that's so important to us. We're encouraged by the roadmap's forward-looking approach to the cross-cutting goals on integration, multi-sector coordination and ownership, particularly with measurable targets for advancing them. We well know that these are critical areas for action, but without a common roadmap and defined targets, it's challenging to make progress on them, let alone be able to measure it.
Yeah.
I also wanted to say that, as we've discussed, this roadmap is launching in a time of unforeseen circumstances that has created a lot of unanswered questions for how we will operate over the next decade. However, I want to share, and we want to share from MSD's perspective, that based on our experiences in the NTD community for more than 3 decades, and with this roadmap as a guidepost, we feel quite optimistic about the progress that will be achieved. Meeting ambitious elimination targets, advancing cross-cutting goals, all while addressing the challenges presented by external factors, such as the one that we're facing now, all tap into what we see as the strengths for the NTD community. Certainly, managing complexities is not new in this space. From MSD's experience, we've been managing complexities since the beginning of our donation program. From implementing what was at the time a new model for drug distribution to addressing some of the issues presented by LOA in Central African countries, and importantly, establishing cross-industry coordination for joint interventions through our partnership with GSK for LF elimination. Collectively, we've succeeded in managing these complexities as the result of a strong partnership model through which we've operated throughout our entire donation program. And this model has been based on clear roles for each partner, an established regular mechanism for dialogue and review of progress and new evidence, flexibility, and really importantly, defined mutual goals. So when we look forward, the 2030 roadmap lays out these defined, collectively owned mutual goals for the NTD partnership. These common goals, as we see it, are critical for success. And based on our experience, we want to encourage a few things. One is for each partner to define and articulate their unique role in contributing to the goals. The implementation of action to be aligned with individual country priorities. Dedicated space for regular communication and review of progress and new evidence, and for everyone to be ready and open for the flexibility that's going to be needed along the way. Thanks for the opportunity to share some thoughts.
Thank you, thank you. It was very proactive and ready for action. So defining roles, implementation to be, aligned with country priorities. These are all things that are important. Dr. Dhingra, perhaps your perspective is required here as well. No doubt India is highly committed to overcoming NTDs through strong political resolve and domestic financing of its NTD services. Yet the country has one of the highest burdens in terms of diseases such as dengue, lymphatic filariasis, leprosy, rabies, snakebite. So against the backdrop of COVID-19, which of the shifts in the roadmap do you feel will be significant in the continued implementation of your work, especially in vector control and, in vector control, and treatment?
Thank you, Patricia. First, let me say this, the time at which this meeting is being held is very important. When India reports around 350,000 COVID cases and around 11,900 deaths as of today, these things become very important. From my side, let me say how COVID evolved in India. Initially, when we were just starting this year, that means somewhere in January 2020, we started planning for the whole of NTDs, especially VL, LF, leprosy, dengue, chikungunya. We started planning right on in the beginning of the January how it go about. And then when this COVID came, and 25th of March was a lockdown for the whole country. But fortunately, the COVID in India evolved in a different manner. Basically, the COVID was more in urban areas where these diseases do not have a major burden. That was one aspect. Number of things that had been initiated. For example, the endoresidal spray, which was started for visceral leishmaniasis, had to be stopped because 25th was lockdown. Similarly, number of activities on LF, which were already going on MDA, had to be somewhat curtailed at that time. Definitely, but because of the commitment from the higher ups, immediately we were asked to work out how we'll do even when COVID goes on. That means in the containment zone, in red zones and other areas, how the activities of all entities will continue. Similarly, we had to make guidelines along with the containments, along with the lockdown, how would continue all our activities. And all circulars were issued to all the state governments so that everybody knew what needs to be done, even in times of partial lockdown, which went on later on. That was one of the things that was done at that time. And the best part was, what I would like to share is, the guidelines that were issued were sort of region specific, were also specific based on the COVID. Wherever the COVID areas were involved, how they would do in high COVID areas or in less COVID areas. So that was done right at that time. And it was issued all throughout the country. Also, let me tell you that during this lockdown and the phase, we took an opportunity to assess ourselves, especially, the MDA was being planned in a staggered manner in country. Especially this year was very important for us because we were upscaling IDA to 50 million population, and that was what was envisaged. What we have done during this lockdown period, along with our partners, all our stakeholders, we have worked up and revised all our SOPs for going for IDA and MDA, which we plan to do somewhere in September, October, thinking the COVID situation improves. So that is what we have organized, along with the domestic funding also, the ivermectin, which was provided through Mechanism Donation Program, through WHO. Now what we have done is, even government, domestic government funding also has been provided to procurement of ivermectin. So that has been there, and that is very important. Now with the partial lift with the lockdown, what we are now getting back to all our strategies, which involved active case detection and treatment for visceral leishmaniasis, also looking into distribution of LLMINs, the vector breeding checking for dengue, chikungunya, fogging has been initiated, and all this has already. We also are looking at integration for the morbidity management of LF with leprosy, and that also has been initiated.
Okay.
The best part of all this part is, what I would like to say is that during all this phase, our stakeholders, there is a long list, I wouldn't be able to name all of them, but especially CARE, the PSR, the GHS, the research institution, the London School, the Liverpool, the ICMR, everybody worked with us during this period. And I think I hardly had a day off when we were not on this type of virtual meetings with them. And that has really paid a good way.
Yeah.
I would also like to convey to you the strong commitment which we had from our ministry. They said that you have to work because we are very close to the elimination of visceral leishmaniasis. And that is the topic that we had to work on. And that's why we worked on it and revised all our guidelines during this phase. And I think that the way that we are going on now, the situation that we are picking up and the incidents that we have seen, luckily there has been no increase in the incidents as compared to the last year.
That's very
That is the phase, that is what we are seeing.
These are some very interesting perspectives, and of course, different challenges in each country. And it takes me back to what to remind you of what Rachel Taylor was saying about implementations being country specific. Dr. Wendy Harrison, you're involved in both implementation and academia. How do you think your organization and the networks of which you're a part can best support WHO's push for research and scientific input to ensure quality of norms and standards? Going back to also what Dr. Dhingra was alluding to.
Thank you, Patricia. And again, just to add my very warm thanks to the WHO for inviting me to be on this panel. So I think that really out of respect for those who've suffered and unfortunately continue to suffer through the COVID-19 pandemic, I think we really have a responsibility to learn the lessons offered by the crisis. And importantly, the opportunity to actually really review the way we work and those norms and standards that we've previously adhered to. And I think there's sort of three main areas. Firstly, I think the urgency for and the dynamic use of research, obviously the rapid development of assessment tools and interventions that are constantly reviewed for effectiveness is kind of central to a pandemic response. But in the NTD community, there's an opportunity for us to use the modelling to predict the impact of changing our programmatic strategies, and then to rapidly implement and evaluate the effectiveness of these changes. And this approach to research has definitely been embraced by the NTD community in principle, but is this an opportunity for us to try and accelerate our progress by being even more dynamic and adaptive? And secondly, really effectively identifying the evidence gaps. Now, obviously for COVID, it being a novel virus, the gaps are quite clear. But the new roadmap, by positioning NTDs in a more development context and by really clearly articulating the comprehensive sets of interventions that are needed, allows us to transparently identify where those evidence gaps are. And for organisations like ours, we can see where we can put our skills and resources most effectively to fill those evidence gaps, and then obviously translate those into better implementation. And finally, how we work together to implement the research findings. Obviously, one requirement for this kind of adaptive approach is strong partnerships between implementing organisations and research agencies to allow the effective cycle of evidence to practice and then back again. So as an organisation, we have an excellent example of this in the Paediatric Praziquantel Consortium that brings together the pharmaceutical industry, academia, country programs, and NGOs, so that evidence can be generated and then very quickly translated into practice, and then the lessons learned again can go back into the research process. Also, the NTD NGO network, of which our organisation is a very enthusiastic member, brings together NGOs and research organisations and really has this approach at heart. So I think this puts us all in a really strong position to be able to further embrace this approach to standard setting and generate new and much more dynamic norms. Thank you.
You had mentioned One Health earlier there. Why are they so important post-COVID?
Yeah, well, so as a vet working in human health and a long-term champion of the notion that people, the health of people, animals, and the environment are all interconnected, I really see this as the moment for not only acknowledging this link, but really acting on it. We're obviously all aware of the part that the animal-human interface played in the COVID transmission. But for NTDs, the One Health approach is absolutely essential when we acknowledge that actually over half of the NTDs have an animal as part of their life cycle, and especially given the reliance on livestock of many communities that are at risk of NTDs for their livelihoods. And in some cases, the health and productivity of animals determines whether children can go to school or families are able to access healthcare.
And also many of these affected populations are in hard to reach areas. So linking the delivery of medicines and sometimes even services for animals and people can actually provide a very significant cost saving.
Mm-hmm.
So the inclusion of what the One Health approach very explicitly in the WHO roadmap has given a really helpful mandate, and with that focus on cross-cutting approaches. However, there still really needs to be a change in the way that we conceptualize and fund and plan NTD programs to fully acknowledge the need for the assessment of the threats, but also the potential benefits of working across the human, animal, and environmental interface. So I guess my hope is that the disruptive effect of the pandemic will give us that opportunity to make this shift and ultimately build back a better future than the one we faced before this crisis. And really not only working to strengthen health systems, but also to build actually a healthy ecosystem where all the species can thrive in a balance with their environment.
Yes, and healthy holistic ecosystems, but there's 20 NTDs in total. There's an even greater sense of urgency around bending the curve, and so ultimately ensure healthy lives as well for all ages. Water, sanitation, and hygiene. Again, cross-cutting. The new roadmap emphasizes strong coordination with WASH services. Helen Hamilton, thank you for joining us. What is your message to colleagues in ministries of health on coordinating WASH activities with NTDs?
Hi, Patricia, and hi to everybody who's on the webinar. I'd like to echo, first of all, my thanks to you and to WHO for the invitation to join this panel. First off, from WaterAid and the WASH sector side, we really welcome this roadmap. And from our perspective, it further embeds WASH and NTD collaboration to really bring the two sectors together, and emphasises that accelerating progress on these diseases necessitates targeted interventions to improve access to clean water, decent toilets, and hygiene services. And we know that reducing WASH preventable diseases is only one element in terms of the impact of WASH on human health. We know that other benefits include addressing safe, inclusive care, promoting dignity as well as human rights, and also that overall promoting overall well-being. And so one of the things I really wanted to emphasize is just the breadth of the tools and strategies that we currently have to make collaboration as practical and straightforward as possible. We have the WASH and NTD strategy from WHO that's currently undergoing an updating process. We also have the WASH and NTDs toolkit that was launched last year, and that really supports, in a very practical, pragmatic way, joint planning, sharing of data, joint monitoring, and improving evidence, and is able to walk colleagues who want to work closely between WASH and NTD sectors through that process. And then finally, CSOs and NGOs such as members of the NTD NGO network, as Wendy mentioned as well, and their WASH working group within the NGO network are really here to support country leadership. And so, we know that coordination and multi-sectoral working is mandated from ministries, but it will need to be intentional. And we know that lots is already being done. We have great success stories from Kenya, Ethiopia, with really valuable lessons to share. So one of my call outs would very much be around, just continuing to share those lessons between countries. And we've heard from previous speakers again on the importance of resilient national systems to sustain and protect the gains that have been made on NTDs over so many years of work. And really investing in WASH systems and services and collaborating across these sectors in a really dynamic way is core to that work, but also to building that resilience now and to any potential future crisis we also may encounter.
And I'm sure you're not lost to the opportunity, the current COVID-19 messaging that strengthens the link between WASH and NTDs. Just moving to Dr. Aditama, having listened in to all this, information that is essential for finalizing the new roadmap, and having heard that countries in the Southeast Asia region carry one of the highest burdens of NTDs, how can WHO help countries implement the new roadmap to surmount the effects of COVID-19?
Okay, thank you, Patricia. Let me begin with a greeting from Southeast Asia region of WHO. This is a region with over 25 of world's population, and large percentage of this population actually live in area endemic for or in conditions suitable for NTD. Also, I would like to mention that the globally highest burden of NTD, such as LF, leprosy, and STH, are found in this region. In this regard, I should mention that the region takes pride that in NTD program activities primarily funded domestically. There are very few partners in most of the countries supporting the program. I should also mention the significant progress has been made in the region. One of the 3 countries endemic for YOS have eliminated the diseases. 3 countries have eliminated LF as public health problem, and 1 country has achieved the target for trachoma. We hope to achieve elimination of 3 diseases in 4 more countries in the coming 5 years, and I'm sure that this roadmap will be in line with this our target. Talking about support, as your question, the free drugs received through generous donation of pharmaceutical company remain one of the key driver of this success. So the vital support needs to expand the meet of regional demand, and for instance, with the introduction of triple drug MDA to fast track LF elimination, the donation of ivermectin must meet the requirement for countries to take full advantage of this innovation. Also, in the transition of LF to STH, so the donation of dewarding tablet will be very important. So, talking about the new roadmap, this is not only very interested to sustaining the achievement what we have made, but also to more ambitious in the future.
Yes.
Our RD, the one that just mentioned, speak in the first panel, have a framework of sustain, accelerate, and innovate. So so we will make a regional roadmap after this global roadmap with the sustain, accelerate, and innovate. This is basically our activities in the region, and I believe could give an impression how WHO support countries in the NTD.
Going forward. Thank you so much, Dr. Anitama. We've only got about 11 minutes for questions, and already so many have come in, so we're going to try and answer as many of them as possible. A question to Charles Mwansambo, Dr. Charles Mwansambo, what strategies were used to ensure high participation to NTD control program activities such as NDAs and focal surveys, given the fear experienced by people in communities to COVID-19? Dr. Mwansambo. All right, whilst he...
Thank you very much for that question.
You got that, right?
COVID is just hello?
Yes.
Oh, yeah. Thank you very much for that question. I mean, and I know there is indeed fear of COVID, but what we're talking about here, it happened before we had the epidemic in Malawi, rather the pandemic. Because it's February that we got the notification, and we only had our first case of COVID beginning of April. So most of this work happened long before COVID. And I must say that using our community systems, the health surveillance assistants were able to penetrate the communities, and so too going through the school. So the job was much easier than it would be at this point in time.
Oh, okay. A question to Mark, to Merck and Sanofi. Beyond COVID, with the growing attention on non-communicable disease like cancer and diabetes, how will the pharmaceutical companies ensure commitments to NTDs? We have Luke, or perhaps you'd like to start us off on that?
Rachel, you want to start, or
Rachel?
I give her the chance. If not, I'll start.
Okay.
All right. So for us, I mean, of course, it's true that to achieve the goals of universal health coverage, right? It's not only about NTDs. Why did we continue to work on NTDs, but not in isolation? We have programs on malaria, on TB, and on non-communicable diseases. And again, I think we prioritize all those programs appropriately in order to achieve the goals of primary healthcare and universal health coverage.
Rachel, you there? Yeah.
Yeah, I would certainly echo what Luke has shared. And I think just as an example from our company, you know, we continue to invest in new novel research programs for infectious diseases, antiviral programs, and vaccines as a part of our core commitments as a company. So we really see our strengths and our research priorities, and when we look at access as looking at the full continuum of the burden of disease and where we can have the greatest impact.
Okay. Another question's coming here. Several questions around the impact of COVID-19, not as a disease, but as the impact of COVID-19 on research, on funders and donors who shifted their focus. What can be done about this? Neeraj, would you like to go for that? There are a number of questions here around the impact of COVID-19.
Thank you very much. I think as far as the funders are concerned, I wouldn't be able to say that. But as far as India, we have not yet seen any issues regarding the funding, because there is a commitment for the next 3 years on this aspect. In the coming days, if resources shift, then it will be a problem, because we are on the doorstep of eliminating visceral leishmaniasis, and as well as we are upgrading LF from MDA to IDA, so those will be very important. I would definitely like to say, when you're reaching the last phase for elimination of a disease, research is of utmost importance. You cannot in any way try to decrease the amount of research that has to go into that, because it is at that time the research will be important both for, like somebody said earlier, for getting newer diagnostics, or maybe changing the last mile strategies, which will be very important. Not to say to be on guard of any outbreak, which also research will be important.
Okay, thank you. To Wendy Harrison, partnerships have been mentioned a lot. Do you think the new roadmap work to ensure in the equity of partnerships rather than more traditional paternal partnerships? Let me read that again. Partnerships have been mentioned a lot. Do you think the new roadmap work to ensure in the equity of the partnerships rather than more traditional paternal partnerships?
Yeah, thank you for that. And I think most of our speakers actually today have kind of underlined the need for that partnership. And I think the roadmap really sets out very clearly those 3 key shifts that Mweli talked about. That I think in each one of those there's an underlying message for the partnership. The move to a much more impact-based approach means that the importance of research partnerships and organizations that are expert in monitoring and evaluation is incredibly important. The shift from a more siloed approach into that cross-sectoral piece indicates where different sectors, and we've obviously heard from Helen Hamilton, from WaterAid and veterinary public health organizations. You know, it's really key that we build out those, and probably most importantly, with the last shift towards country ownership, where we all, obviously we're all working closely with the ministries of health, but we need that shift of partnership very much as other organisations as a supporting role for the ministries of health, and ensuring that we're building a longer term capacity for that development of those resilient, adaptive health systems that many of us have talked about.
Yeah, thank you, Wendy. And a question here for Leda. With COVID-19 taking over the global stage, will there be enough resources to deal with the 20 NTDs, especially the lesser priority ones at a national level? Dr. Leda?
Yes, actually, because of the COVID pandemic, of course, most of the budget for NTDs were channeled to COVID. So what we were asked by our secretary is to ensure the continuity of program implementation so that our NTD targets will be achieved. So the integration is to be done because of this, because most of the budget for each NTD programs were used for the COVID pandemic. But we have our LGU partners, so I think latter part of this year, hopefully, the COVID will be improve the COVID situation. Then we are doing a lot of Zoom meetings with implementers and asking them and what are the activity strategies that they will be doing amidst the COVID. And there are different, the different provinces in the Philippines had different status as far as the COVID situation. So in areas where COVID is not that problem, they are willing to pursue the critical activity for each of the NTD program.
Okay. I want to just squeeze 2 more questions in if I can. For Musa. How can we use M&E data more effectively to get government commitment to NTDs in the next decade, especially in donor-driven countries? Dr. El-Hag.
Thank you, Patricia.
Mm-hmm. You have about half a minute to be able to answer that if you can.
I will try to be more fast. I think one of the most important things is the data-driven decisions. Now we are working with the DHIS Directorate at the Federal Ministry of Health to include all the neglected tropical disease in the national dashboard. And even last year, we introduced the integrated NTDs scorecard, where we included all the PC NTDs and the IDM entities in one scorecard to be presented to the state governors and to the higher authority at the Federal Ministry of Health and the Ministerial Cabinet.
Okay, thank you so much. And one last one for Helen. NTD's interventions promotes integration of cost-cutting strategies for obvious reasons. How far are we on this in the last 1 decade, for example, with WASH?
Sorry, could you repeat the question, Patricia? It broke up.
So yes, NTD's interventions promotes integration of cross-cutting strategies for obvious reasons. How far are we on this in this last 1 decade, for example, with WASH?
Thank you. So I think we've got some great examples of where that's working. As I mentioned, the WASH and NTDs framework in Ethiopia. We have the SAFE strategy that's embedded, that includes WASH approaches within efforts to control and eliminate trachoma, and the NTD NGO work to develop the best framework, which brings together behaviour, environment, social inclusion and treatment, is absolutely fundamental to this. So I think we have some excellent examples to build on, both at global and national level. And as a number of panelists have highlighted, I do think the response to COVID has really incentivized that partnered working between WASH and NTDs. We know that mass hygiene behavior change programs are going to be absolutely critical to addressing COVID, and the NTD community has impressive community and school-based platforms. But at the same time, we do know that there's a real challenge around investment in hygiene. Globally, 3 billion people still don't have access to water at home, water and sanitation at home. So we really do have to work together in a partnership to ensure that we've got safe, quality treatment for care and prevention of NTDs through WASH.
Thank you. Thank you so much, Helen. And thank you all to all the panelists as well. I would like to ask that you remain online, please, for a group photo. And for all of you, for your commitment to this new journey to eliminate NTDs. If this is the mood for the future webinars, we're certainly on our way to a roadmap that delivers on its targets, and that can be something you wish for the billions who are struggling, and that shouldn't be. On the subject of webinars, we'll be meeting up again in a few weeks from now. Kindly put a save the date in your calendars for 8th of July to discuss how the NTD roadmap contributes to sustainability and resilient health systems. Until then, thank you and stay safe.